Hello, my name is Alex Surratt. I'm a student in the Health Education 300 class at American River College with Professor Chuck Weloka. Thank you for being in my audience and listening to my video. Let's talk about alcoholism or alcohol addiction. Let's start off with the definition of addiction. Addiction gets defined as, according to Merriam-Webster, as a compulsive, chronic, physiological, or psychological need for a habit-forming substance, behavior, or activity having harmful physical, psychological, or social effects, and typically causing well-defined symptoms such as anxiety, irritability, tremors, or nausea upon withdrawal or abstinence, or the state of being addicted. Next, let's talk about the definition of an alcoholic beverage, since you already know the definition of addiction. An alcoholic beverage, according to Britannica, gets defined as alcoholic beverage, any fermented liquor such as wine, beer, or distilled spirits that contain ethyl alcohol or ethanol, CH3CH2OH, as an intoxicating agent. A brief treatment of alcoholic beverage as follows. For full treatment, see alcohol consumption. Now, we talk about addiction to alcoholic beverage. Let's talk about the definitions of alcoholism. The definition of alcoholism. According to David Hellwig, alcoholism is a popular term for alcohol abuse and alcohol dependence. The hallmarks of both these disorders involve repeated life problems that can be directly tied to a person's abuse of alcohol. Alcoholism has serious consequences, such as affecting an individual's health and personal life, as well as having a negative impact on society at large. Alcoholism is the use of alcohol in any harmful way. There are three parts to the trend statistics of alcohol addiction. The first one is alcohol use disorder in the United States. It's a problem. There are 29.5 million people aged 12 and older that had AUD in 2022. And it's widespread across a huge chunk of Americans, which we'll talk about in parts 2 and 3. Now that we're in part 2, let's talk about these trend statistics. According to the National Institutes of Health, NIH's National Institute on Alcohol Abuse and Alcoholism, NIAAA, a 2022 examination, there are nearly 30 Americans who are 12 years old and up to experience the condition connected with the excessive consumption of controlled substances. The NIAAA mentioned that over 17 million men and over 12 million women, 1/8 of men within the group, and nearly 900 of women within the cohort experienced excessive consumption of controlled substances and its effects. There are nearly 19 million Caucasians, over 1/10 of Caucasians in the cohort who are at least 12 and experience the excessive use of controlled substances. The NIAAA stated that nearly 3/5 of a million biracial Americans who are 12 years old and up, nearly 15% of people within their group, experience a condition regarding excessive use of intoxicants. According to the NIAAA, between 5 and 6 million Latinx Americans, aka Hispanics, Latinos 12 years old and up. Just above 1/10 of people in this group experience alcoholism or alcohol addiction. 4 million people of Afro-American origins 12 years old and up. Just over 1/10 of people in the demographic had conditions related to alcoholism and addiction. Nearly 1 million Oriental Americans, 3 out of 50 people in the demographic. 11% of Indigenous Americans, or barely above 150,000 people, deal with the condition of excessive consumption of controlled substances. Now we've talked about the trend statistics. Let's talk about the short and long-term effects. The short-term consequences of alcohol addiction, part 1. According to Alcohol Think Again, as someone consumes controlled substances, you're impacted neurologically within a short time, impacting your thoughts, senses, and conduct. Alcohol Think Again stated this is because the level of alcohol in your blood increases, also known as blood alcohol concentration, or your BAC. Finally, Alcohol Think Again mentioned that impacts of controlled substances in your body can range from feeling self-assured, so in other words, you're feeling confident in yourself. There are hindered decision-making skills, or your impaired ability to converse with others, to queasiness, to forgetting things that happened. That's one part of the short-term consequences. Let's talk about the next part. According to part 2, features information for the CDC. So according to the Centers for Disease Control and Prevention, the CDC, they mentioned that excessive alcohol use has immediate effects that increase the risk of many harmful health conditions. These are most often the result of binge drinking and include the following: injuries such as motor vehicle crashes, falls, drownings, and burns; violence, including homicide, suicide, sexual assault, and intimate partner violence; alcohol poisoning, a medical emergency that results from high blood alcohol levels; risky sexual behaviors, including unprotected sex or sex with multiple partners. These behaviors can result in unintended pregnancy or sexually transmitted diseases, including HIV. And the last short-term consequence of alcohol addiction is miscarriage and stillbirth or fetal alcohol spectrum disorders, FASDs, among pregnant women. We've discussed the short-term consequences of alcohol addiction. Let's talk about the long-term consequences of alcohol addiction. And there are some big ones here, guys. This is huge. The Centers for Disease Control and Prevention, the CDC, mentioned that over time, excessive alcohol use can lead to the development of chronic diseases and other serious problems, including, and there are some very serious conditions here, guys. There is high blood pressure, heart disease, stroke, a lot of cardiovascular concerns, hypertension, liver disease, and digestive problems. Many cancers come from the long-term consequences of alcohol addiction. They include breast cancer, mouth, throat, esophagus, voice box, liver, colon, and rectum. Alcohol addiction can weaken the immune system, increasing the chances of getting sick. There can be learning and memory problems, including dementia and poor school performance. There are mental health problems that can occur, including depression and anxiety. There are social problems, including family problems, job-related problems, and especially unemployment becomes a concern. And the top one, which we're discussing tonight, alcohol use disorders or alcohol dependence. Now, although there's a lot of detrimental impact that happens with alcoholism or alcohol addiction, there are positive actions that should be taken about the topic and why. So here's part one. Little Creek Recovery mentioned that it can be challenging for people overcoming the excessive consumption of controlled substances in the rehabilitation process. People need to be supportive of others who have histories of alcoholism. My friends have had many family members who struggle with the condition, and this is essential because according to Little Creek Recovery, nearly 3/5 who consumed worsened. People should promote the ways to avoid alcoholism. According to the website Positive Action, the essential thing is that anti-alcoholism promotion starts at an educational setting, and analysts recognize productive features, including plans connected with campuses, which must be thorough and feature cultural growth, participation from legal guardians, and plans to evade detrimental social influence. Now to part two on positive actions that should be taken and why. In addition, Positive Action stated that alongside direct curriculum about risk of using controlled substances, pupils should acquire knowledge in individual behaviors which do not condone the consumption of spirits, while directing pupils in the right direction towards situations featuring quality well-being for everybody. As a junior high paraprofessional, I participate in programs where we influence pupils to avoid scenarios such as peer pressure, where the consumption of alcohol can be present. This is essential because students will be heading to high school and peer pressure evolves as youth get older. Instead of discussing the negative consequences of alcoholism as an educator, I plan on discussing what positive impacts avoiding alcohol could have. There are a lot of learning opportunities for both educators and pupils regarding why alcoholism is detrimental for everybody around them. Here are my references for my information for my presentation. And I'd like to wish everybody a very pleasant evening, and thank you so much for listening to my presentation.